Hi, it's Tom here from Running Physio. I'm so excited to be speaking to you today because today we have just opened enrollment for Running Repairs online. So it's a brilliant time for us. This has been something that has been a big passion project for me for about a decade really, of putting together all the knowledge and expertise about running injury management so we can share it with you. So that's open now. It's only open for a short period of time though. So check out the link in the title there to explore that. Now, what I'm going to be doing throughout this enrollment period is talking through different snippets from the course to share some of the information for you. And today we're going to be talking about a key slide, one of the first slides we put together when we started creating Running Repairs. And that's about how we balance training load and our capacity to manage that load. And we're going to use that with an example of a runner with lateral hip pain, talking through how we might use that in our reasoning process. Then throughout this launch period, and it's not available forever, so it's only a short window to sign up, but throughout this period we'll be sharing little snippets each day with you, and I look forward to your comments, your questions and your ideas on this. Okay, so let's start with the slide that we want to share from Running Repairs Online, which is this one. Now this is from module 1, which is called Restoring Balance, and it's all about this idea of trying to find a better balance between the load that's being placed on the tissue and the tissue's capacity to manage that load. Now what we think happens is if you overload a tissue, if you load it above its capacity, it reacts to it, often in a way that includes pain. So we want to try and find a better balance then between the training load and a runner's capacity to manage that load. So we've got to be able to look at both sides of this seesaw. And we've also got to recognize that we're not treating tissues that are being loaded, we're treating people. So we've got to get to know our athletes, what drives their training, what will drive them in rehab, and what their understanding is about their injury. So on the training load side of this seesaw, we want to find out about the training, the volume, how much training they're doing, the intensity, how hard it is, the frequency, how often, and the type of training. Are they on the track? Are they on the hills? What are they doing? But also think outside of training, what else is going to be loading their tissues? So this could be work, family life, various habits like sitting postures. It could be other sports as well. So a good subjective assessment, and we talk you through this in Running Repairs Online, really helps us to identify how the tissue is being loaded, and then that helps us to adapt it. And then on the tissue load capacity side of things, again, we've got subjective information that we want to get from the runner in their assessment about how much running they're coping with and what their symptom response is to that. But also we've got other things that will influence our capacity to manage load, like strength, control and flexibility. And of course, we go through how you can assess this in a runner in detail in Running Repairs Online. So then hopefully by doing a good subjective and objective assessment, we're getting a good picture of both sides of this seesaw, which allows us then to plan our treatment process. So let's say we do this in a runner who presents to us, a female runner with lateral hip pain. We can then pop some of those assessment findings into this seesaw, and this is quite a nice way of reasoning things through. I recommend maybe trying this with 1 or 2 patients that you've got to help you kind of get clear in your mind what you're trying to work with, and maybe share it with the patient too, because it's quite a nice visual way of looking at things. So we get to know this runner who's got right-sided lateral hip pain that we think is coming from a right-sided gluteal tendinopathy. And we get to know the kind of training load side of things. So we discover that her training is increased in distance, and she's also increased the amount of hill running that she's doing. Now, what we want to make sure is that we're finding about information that's relevant to her and her pain. So we know, for example, that hill running is going to increase the stress, particularly around the hip and the glutes. So it would make sense perhaps that would lead to some overload of tissues there. We also want to have a look at the running gait, so perform gait analysis to see if that running style is placing more stress on the glutes. And we discover that she runs with quite a lot of hip adduction on that right side, which we'd imagine would load those glutes in a slightly more painful position. But then we want to go beyond training and running and think about what's going on in this lady's life. Now, she works as a yoga teacher, Now, with yoga and with long-held stretches, it tends to be provocative for gluteal tendinopathy. We think because stretching tends to lead to compression of the tendon. And of course, we'll talk all through that in our tendinopathy module for you. So we know it's likely to be provocative, so we want to see if we can reduce some of that stretching load through yoga. Then we've got to strike a bit of a balance with this person because this is their work. So we might look at how we adapt it. Can she try maybe cutting down certain poses she might use, things like pigeon pose that are going to go into positions with a lot of stretch around the lateral hip? Could she sustain those stretches for a little bit less time or not push so much towards end range? Or could she look at doing different types of yoga that have less of those painful positions? So it's not here about avoidance, but can we bring the load down to a level closer to her capacity to manage it and being guided by her symptom response? And we also might think outside of work as well into family life. Now, this runner happens to have a young child at home, and her habit is to carry that child on her right hip. Now, if you picture that in your mind for a moment, what we often do, if you've got a young child at home, to carry them on a hip, is you push that hip out to the side to kind of balance them there. So you take that right hip into an adductive position and maybe rest there for quite a while whilst we're looking after that little one. And again, that might add to the irritating load on the tendon. So hopefully this good subjective assessment, really getting to know this person, allows us to identify some of these provocative loading strategies so that we can change them. And then we want to assess her capacity to manage load, so including things like strength and control. And we discover that she's quite weak in glute med and glute max. And we know from a lot of the tendinopathy research that muscle strength is very important. We discover that she's got a lack of control, particularly around the pelvis. And we want to bring this back to something relevant to her. So she tells us perhaps she gets pain going downstairs. So that's the movement we choose to assess and discover there's quite a lot of pelvic drop when she's loading that right limb as she's coming down the stairs, again, potentially irritating the tendon. But of course, as we've touched upon, we're treating people here, so we've got to get to know the person and keep them central to what we do, which again is a really important part of running repairs online. And getting to know her, we discover she's very stressed. Like many people, she's juggling the demands of work with young family. She's not sleeping very well. So she's not really getting a great deal of recovery here. And that's something we'd want to address as well, because we know that stress, unfortunately, can increase pain and delay healing. So we've put some of these findings into our kind of seesaw here to allow us to reason through how we might have a situation where there's excessive load upon the tissue and not quite enough capacity for this person to manage it. Next up, we want to plan the treatment process. And here we can plan to balance things out. So with the training, to bring it to a manageable level, we're going to reduce training and perhaps stop the hills, or at least reduce the hill runnings until it becomes less irritable. We might try some gait retraining to reduce hip adduction. Simple cues can be really effective to do that. And of course, we talk through all these different cueing options in running repairs online. We modify her work to reduce the compressive load on that gluteal tendon through stretching. And maybe we have a look at some of her habits. Perhaps she can think about carrying her little one on the other hip, or maybe not carrying the little one so much, just to allow things to settle. And it is this concept of balance here. It's reducing the load to a manageable level, not avoiding it altogether. We know load's good for the body. It's just finding a level that matches our capacity. And then in terms of building this capacity, we can plan to strengthen the glutes, but perhaps do so out of painful positions, such as loading in hip adduction, and this may surprise some people, loading with exercises like clams are often quite provocative. That's quite a challenging position for the tendon to work in. So perhaps we do some low-level strength work out of those positions to build up glute max and glute med strength, and progress over time by increasing the load and then gradually working into these challenging positions with a bit more hip adduction. And I think we'd need to in this patient, because she's a yoga teacher. She's going into positions where she needs to load the muscle and tendon in a more stretched position. We might try and change the way that she comes downstairs, particularly in this irritable phase, by using movement cues and building control around the pelvis to reduce pelvic drop as she comes down the stairs. And then we want to try and help her with physical and mental recovery strategies, particularly trying to increase her sleep and talking about tactics that she might use to do that. And we've got to remember, we need recovery not just for the physical stresses in life, but for the mental ones as well. So if she's very stressed, we might team up with a local counsellor or mental health professional, or look at various coping strategies that she can use to manage her stress and improve both her physical and mental recovery. So there's a whistle-stop tour really of this concept of restoring balance between the load on the tissue and the capacity to cope with load. And I think this model is really helpful for us to plan treatment, providing we remember to keep the patient central to what we do. We get to know the athlete and we're working towards their goals. We don't want to get too bogged down in the focusing on tissue side of things. And this is just one snippet of Module 1. There's so much more in Module 1 about load management, about psychosocial factors, about really key concepts to understand in the management of running injury. And then of course we build on that through the course. In Module 2 we talk about subjective and objective assessment, all the key assessments and tests you'd want to do. In Module 3, we take you through how you can do gait analysis and retraining in your clinic. Module 4 is devoted to strength and conditioning. We've got a fantastic collection of different exercise videos, as well as some excellent theory to support them. Then Module 5 will guide you through the return to running process, which is so important, including a selection of different training plans that you can use to get people back on track. Then from there, we dive into all the key pathologies: tendinopathy, bone stress injury, patellofemoral pain, muscle pain, all the things that you're going to see in clinic. And we believe Running Repairs Online is the most comprehensive collection of running resources available today. We've got 18 fantastic modules. We believe around about 50 hours in total. So we'd really love it if you'd click on the link, find out a bit more about this program, and join us on Running Repairs Online. Okay, thanks for listening. Bye for now.